Okay, welcome. Thank you for attending. I'm kicking off a series on stress, and I think, and I'm just kind of chuckling and laughing to myself because today was actually a rather busy day, and we're back at the clinic, and there's a couple of new patients that was scheduled this morning. So, note to self: don't schedule a Facebook Live right when there's a lot going on. So, but I'm super happy to be here again. I took a few weeks off of doing some Facebook Lives, and I've missed it. I've missed kind of sharing with you some of my information. So thank you for attending. And I titled this, Are You Stressed? And now we opened up Brio about a week ago, seeing patients again. And I think this overwhelming response that I'm hearing is things are, this new normal is pretty tough for people. And I think a lot of people are not realizing just how stressed they are. So I hope in this series that we're gonna address a little bit more the root cause of stress. Today is going to be more of an intro, and I'm going to ask you to please share this with your friends because I really welcome your feedback and the topics that you want to learn more about stress. So today I'm going to do an overview from my perspective, what I think would be helpful to learn, but it's more important that I hear from all of you, like what's relevant in your life. So right now, I guess the new normal that I'm hearing is people are working from home, with kids around. That's a bit challenging, or they're working from their dining room table, or they're just like zoomed out with too many Zoom meetings there. And what a lot of patients are also telling me is they're really feeling the effects of stress through pain. So a lot of them are having like back pain. A lot of them are having neck pain. Insomnia is another thing that I'm hearing a lot about this past week, and especially like cravings as well, because all those are tied into stress. And I'm going to unpack all of that in this series there. So my goal is to really help you avoid the burnout and avoid the chronic stress. And I really want to provide actionable tips that you can implement in your life to just become a lot more stress resilient. And I do understand that there's only so much I can share kind of within this Facebook Live. But again, I do want to make it relevant for you. So post your questions, and even after, or email into the clinic. What do you want to learn about stress? So let me introduce myself before I forget. I am a health nerd. So my name is Dr. Jeffrey Lee, and I am both a naturopathic doctor as well as a registered acupuncturist. And I call myself a health nerd because I really love studying, all things related to health. I love studying a lot of the ancient Chinese medicine. There's so much wisdom in there, and I'm also trying to keep as current as I can with a lot of the modern day research there. So I like to integrate that. I like to draw from both Western medicine as well as Eastern medicine and really personalize solutions for my patients there. Now, I'm just going to pause for a moment because I just want to make sure I am connected well. I'm still on my phone, and I will, in this series, I'm going to try to get this on my computer so that I can create maybe some PowerPoint slides. Now, just a little bit about my practice. So I've got a very diverse practice. I treat things from pain management. I treat like digestive issues. I treat skin conditions, hormonal imbalance. So it's a very diverse practice. But one common thing that I see in a lot of my patients is stress. A lot of people are affected by stress, and especially like right now, given this kind of new normal, I think stress is really taking a toll on people, and I think people aren't really realizing that how much it is affecting their body. So the three things we're going to cover today is, are you stressed and not even know it? Number two is, how does the body respond to stress? And then number three, I just want to share with you the Brio methodology, the Brio living methodology, and how I treat a lot of my patients with stress. So I have a lot to share with you. So let's get started. So again, the why. Why am I doing this series there? And I already mentioned to you, like, that this new normal. But in this past week, I'm seeing there's talking to patients. I'm always asking about mental health. I'm always asking about stress. And right now, there's just a lot of uncertainty going on. Even personally myself, just the past few months, it has been quite stressful. Like, I've had to make the decision to close down the clinic, and I think a lot of people depend on me, and whether it's patients or staff and all that. So that was a tougher decision. Just even myself learning a lot about the virus, just studying as much as I can so I can help my patients. But even like watching the news has been incredibly stressful, and also relaunching the clinic, that's been quite busy, quite stressful. And but I think more personally, like a lot of my close friends have been really impacted with what's going on. People have lost their jobs. Living and working in Richmond, a lot of my friends work at the airport, and they're involved in the tourist industry, and that has radically changed. So so stress has been kind of on my mind a lot. And as I'm working with patients more, I'm hearing that same kind of sentiment, and I'm also hearing patients are very honest with me, and I know many of you are struggling with maybe some alcohol issues right now, or cannabis. People are telling me more about just insomnia, needing more sleeping pills, for example, and I think the biggest complaint right now that I'm hearing is just a lot of back pain, neck pain, just and people are, mainly or thinking that it's just because I'm in a bad posture, but stress, the release of adrenaline and cortisol, can really affect your pain levels as well. So I want to address that as well. Okay, so let's start with number one. Are you stressed and not even know it? So I'm going to go through a list of symptoms right now. And if you can participate, if there's a particular kind of condition or symptom that you want to learn more about, I will structure these future Facebook Lives to try to address that, to answer some of your questions, and really make it as beneficial for you as much as possible. So the three common areas that I see with stress is stress affects the body, and the symptoms that I see in the body is headaches. Headaches are very common because of stress. Muscle pain, I already talked about that earlier. Fatigue is a big thing with stress. Even in your body, change in libido or change in sex drive. That's something that really is impacted by stress. Sleep problems, and definitely a lot of gut issues. A lot of digestive related issues. So those are symptoms that are really that stress can have an impact on our body. Now, next is mood. I see stress really impact our mood. So I'm seeing things like anxiety, restlessness, a lack of motivation, or even a lack of focus. And that's quite common. I'm hearing that more and more with a few of my patients, even this morning, just that lack of drive, that lack of motivation, and there's just a lot going on. They feel quite scattered in their mind. That feeling of overwhelm, irritability is a common thing that I'm hearing, and as well as like anger, sadness, depression. So those are definitely mood-related symptoms of stress. So if any of those kind of ring a bell for you, and you want me to dive a bit more into any of those symptoms, just please let me know. Yes, 100% lack of motivation. Yeah, thank you for sharing that, Flavia. That's awesome. I think that's something that I think there's ways that there's a lot of good ways that we can help kind of recalibrate and reset and refocus. But yeah, a lot of people are telling me that for sure. So thank you for sharing. And I also want to share with you the common effects of stress on our behavior. And this is me, like the first couple of weeks in March, or the last 2 weeks of March, when we're learning about what's going on with this pandemic. issues around like overeating. That's a behavior that I really noticed that myself. I was snacking a lot more often. I was kind of emotionally eating. So overeating. Other behaviors are, angry outburst. I know some of my patients are telling me, there's a lot going on at home. They've got to work as well as take care of their kids. So just sometimes they're losing it. So angry outbursts. I talked a little bit earlier about sort of drug and alcohol use, and this is not talked about often. And it's interesting how liquor stores are considered essential service. This is something that when I'm very intentional at asking my patients, where are you consuming more alcohol than usual? Most patients are realizing that they are. So that's something that I think we have to be mindful of. Social withdrawal. That is something that also affects our behavior due to stress, and as well as lack of exercise. So I just gave a list of some things that were just on the top of my head around kind of how stress affects the body, how stress affects our mood, how stress affects our behavior. And I have some really good ideas just of what I want to share with you over the next couple of weeks there on these Facebook Lives there. But again, just let me know what you're thinking. So let's kind of talk a bit more about how stress really works. I wanted to start off by just sharing with you a story. When I was kind of thinking about what to share with this intro series, I remember when I was camping. This is probably about 4 years ago, and I was just thinking of a story around stress. And I've got 2 daughters, and we were out camping in, I think, around the Okanagan, and we saw a snake. And my older one completely freaked out. She saw the snake. She was totally scared. The 3 of us saw it, and then it was kind of like that perception was of threat was the same for all 3 of us. But my older one just freaked out. My younger one was more curious. She was like, "Whoa, that is cool. What kind of snake is that?" She was looking at the body patterns and all that. It turned out to be, it wasn't a poisonous snake or anything like that. But that's interesting. So my point in sharing that story is we all can perceive, or we can all experience a threat, but how we react to it, how we respond, can be very different for each individual. So I just want to say this, and I wrote it this way. So stress could be anything that our body and mind perceives as a threat. Okay, so that's like a definition of stress. But that perception, it really differs from person to person. And how the stress mechanism works, and I'm just going to go through a little bit of science. I'm going to go through it pretty efficiently, and I don't want to bore you, but stress response really begins in the brain. And as we're kind of processing, what's happening, it sends a signal down to our body to release adrenaline. And we've all heard of that fight or flight response. And it's actually a really amazing thing that happens in our body, because when our adrenaline releases, our heart rate quickens, right? And we start sweating. Our blood flow increases. It shunts to our extremities. And so we're ready to run away or to fight there. Our airways expand, so we can bring in a lot more oxygen, especially if we have to run. Our digestion slows down. We don't need to digest food at this time because we got to deal with this crisis. And then energy production shifts, right? We have more energy production in our muscles, but less energy production in other areas, such as the brain there. So in the brain, we actually respond with raw emotions, right? Especially when we're under stress, and we're not always critical thinkers, or we're not very rational around that time there. And then that's all because of what adrenaline does. It saves us, right? It gets us out of trouble. Now that's acute, what I call acute stress. Now the problem is when we we go through a stressful event and then we don't have ways of de-stressing, and we stay in this cycle. And because when we stay in this long-term kind of cycle, or we don't have coping mechanism and we overreact, we over-respond to too many stressful things, and it's not really a real danger, because if we're like stuck in traffic, or somebody said something wrong to us in a certain way, we kind of overreact to that, and that's stress that we shouldn't be processing right now. And I want to talk about chronic stress, because what happens is, over time, when we have chronic stress, we start releasing cortisol, and everyone understands that cortisol is a stress hormone. But I just want to explain cortisol in a way that without stress, we actually naturally release cortisol. Cortisol is actually a very important hormone that regulates our circadian rhythms and our appetite. So cortisol is actually important. It's a natural hormone that gets released. Like, for example, at 2 a.m., our body starts releasing cortisol, and it peaks around 8 a.m., and that's when we should be the most awake, right? We're waking up there. But what happens is, now the main problem with too much cortisol is, especially if we're chronically stressed, or we're burning out, or we're in an overwhelmed state, when we have too much cortisol in our system at the wrong times, cortisol eventually overwhelms our inflammatory system. So when our inflammatory system is overwhelmed, we are in constant inflammation. So I'm oversimplifying this, but that's the gist of it, because cortisol really impacts our immune system. And that's the take-home message. I want people to understand that too much cortisol, consistent cortisol, affects immunity. It lowers our immune system. We're more susceptible to getting sick, but it also leads to a lot of inflammation. And if you've heard a lot of my other talks there, inflammation is really the root cause of a lot of disease processes. Inflammation causes pain. It causes issues with metabolic syndrome, diabetes, fatty liver. So a lot of issues around inflammation. And if you remember, I shared stories of, like, in medical school, where, like, why are we spending so many months learning about inflammation? We want to learn about the health conditions, right? But Dr. Fredrickson was very intentional at saying, understand inflammation, you'll be able to help a lot of people. So I treat a lot of inflammation in my practice there. So I kind of, I purposely went pretty fast through, like, adrenaline, just giving kind of a bit of background information, a bit more about cortisol. Do you have any questions? Any questions on kind of what I shared? Because I just want to use that as a bit of a backdrop and just giving you a bit of information. I think some of you already know this, so I just want to go through that a little bit quickly. And then kind of set the stage for, my intention is to create a stress series that we can really understand what are some practical ways for us to get out of stress, or manage our stress. And I want to get some feedback from all of you into what topics are relevant, but I also would invite you to just share this with friends, especially if you feel like some people are going through a really hard time, and they're feeling quite stressed out right now. I would love to help a lot of people out there. So do share that. Now, I am working on a stress quiz, and I think one gift that I can give a lot of you is to maybe help you gauge where you are in terms of your stress level. For example, are you in overwhelm? Are you burning out? That's kind of the bottom level. And are you in chronic stress? Or are you in more of a balanced state? Or perhaps you're stress resilient. So I'm in the process of creating this quiz that I will, in my future Facebook Lives, I will get that out for you. I invite all of you to take it, share that, get some information. And I'm working on some PDFs to just give you some tangible information that can really help make you a little bit more stress resilient there. So yeah, that's going to come soon, and hopefully I'll get that figured out in the next Facebook Live there. But now, like, just a few more minutes, I just want to conclude by sharing with you how I approach treating stress in my practice. And I think this is very important because I think a lot of people will search online, they'll find kind of what's trendy out there, and they'll do it. They will feel better, but it's usually for a period of time, and then they kind of slip back into an overwhelmed state. So I want to share with you kind of the Brio Living methodology. And for those of you who've been with us for years, you've heard us talk about the weeding stage, the seeding stage, the feeding stage, and then the thrive. So I'm going to zero in on the first two stages, and that's weeding and seeding. Weeding is really helping my patients, take care of the immediate symptoms right now. If you're in a state of overwhelm, I will help you, whatever it takes. Like a lot of times I'll do acupuncture. Acupuncture is excellent at just really helping the body get more grounded. If some of you are scared of needles, there's other modalities that we have at the clinic to just kind of help calm things down. But in the weeding phase, it's all about, let's take care of you immediately right now. Let's just get you into a balanced state, and then we can work on the root cause. So things that I do for weeding is acupuncture, sometimes even talk therapy. I love talking with my patients and just doing a little bit of counseling with them and just kind of helping calm things down. I teach things like deep breathing. I love using herbal medicine, and with the right balance of herbal medicine, you can really calm things down, just bring balance to the body, and definitely nutrition. So those are some strategies that I will use in the weeding phase. And again, part of this stress series, I hope that I can share more ideas with you, and we'll dive a little bit deeper, especially on very specific stress topics there. So weeding is about getting you out of crisis. Now, what I'm most passionate about is actually the seeding phase, because the seeding phase is really uncovering what is the root cause. I really want to help you build that resilience to stress. It's really strengthening the body from the inside out. And over my 15 years of practice, I've helped hundreds and hundreds of patients really get out of stress. And a lot of us, once we get out of that overwhelm state, it's really important to figure out, what system in their body might be a little bit weak, right? For example, is your ability to detoxify, is that weak? Is your ability to deal with inflammation, is that system out of balance? Or how about nutrition? Maybe you can't get enough nutrients in, and you're not building enough energy to have that resilience there. Or is your hormonal system out of balance there? So I think what's very key is we are all unique individuals. So, two patients might come in with the exact same kind of stress symptoms, but their root cause could be dramatically different. And I think that's really important from a naturopathic perspective. We really need to hone in on what their root imbalance is. And in the seeding phase, that's what we do. And in fact, patients who've worked with me for years, when I guide them into balancing each system, I give them the tools that they need to balance each area, hormones, nutrition, detox, inflammation, immune, energy, exercise system. When we go through and balance that, people are so resilient to things like stress. And this is very important. It's because I really want to help prevent patients from really sliding back into that overwhelmed state. And this is essentially what I'm doing in my clinic, so in that seeding phase. So I want to bring this back into what I said earlier about just what I've been observing a lot of my patients. And that's why I really wanted to create this stress resilience series there, because I really want to equip you with tools to build your stress resilience. And so I'm working, I was telling you I'm working on this quiz. I'm also working a lot of PDFs that I'm just going to provide free to a lot of you out there. I think you're going to see a lot of value out of that. But I'm also working on a online course. I know a lot of you out there just can't come in and see me one-on-one. And so I'm working actually on a course that guides you into building that stress resilience. And I'll share more with you. I've been actually working quite hard the past 3 months putting that together. And I'm just putting the finishing touches on that. So I'm really excited to share that with you. So stay tuned, maybe in future Facebook Lives, or I'll try to get that message out there for all of you. So again, I'm going to circle back into what I observed with my patients there. So I think as a society, we've all gone through, a fairly challenging, stressful few months there. But I've really seen that, some of my patients are in, total overwhelm. They're really stressed out. They're just having a really difficult time dealing with it. Yet other patients who are dealing with the same amount of stress, and this is like job loss, this is financial challenges, this is health, issues. But some of these patients are incredibly resilient. And when I'm talking to these patients, I realize that they've done the hard work at building up, that seeding phase that I was just talking about. They're building up their resilience. And that's a message I really want to get out to all of you. So, so stay tuned. We're gonna dive deeper into stress there. And again, for some of those who are just joining us now, I really invite a lot of your feedback. Are there things in stress that you want to, learn more about? Is there a specific topic? And I'll give you an idea. Some things that I'm thinking about is like today somebody asked me about stress and immune system. They were very curious about that. They were in here doing an IV treatment, and they really want to prevent immune issues. So I ended up talking about stress with them, as well as other things to boost immunity. Anxiety and stress, like what's the difference there? And more people are coming in with anxiety. So I invite you to, even when this Facebook Live's over, I'll do my best to kind of keep checking the comments there. And if there's a specific topic on stress, please write that in, and I'd be happy to help you. So again, in conclusion, we talked about, are you stressed and not even knowing it? So I gave you a list of some symptoms, and just pay attention to those symptoms. Like assess your body. Are you having more headaches than you realize? Are you having more aches and pains? Could those be related to stress there? I gave you a brief intro of just adrenaline, cortisol, how the body actually responds to stress. I gave a quick story of just how our perception of stress is different. So that's very important, and I'll unpack that in future Facebook Lives. And then lastly, I shared with you with the Brio methodology of what I'm doing with the weeding phase with my patients, just getting them out of the crisis, just calming things down. And then also in the seeding phase, where I'm really trying to balance the system and build resilience there. So that's what I wanted to share with you. Again, if you have any questions, I'll hang out for a few minutes there. So please, if you have any questions, I'm happy to answer them, or any comments there. Again, I'm here to serve you guys, to try to share with you my years of experience. And I'm fascinated with, for those who don't know me, I'm fascinated with like the brain. I'm fascinated with Chinese medicine, and the past few months I've just been digging in through a lot of my resources to try to pull out some tangible, useful health tips there. I'm just going to check. Sorry, I am on my phone, and if there are comments and I'm not getting to them, I do apologize, but I will catch up in technology when I get a chance to. Now I see a few comments there, but yeah, any questions at all? And again, I apologize if I'm not seeing them, but looks like I don't see any questions. So I'm just going to wrap things up. Thank you for your time, and stay tuned. I invite you back for other future Facebook Lives. I'm probably going to do them a lot closer together. So my plan is, I haven't executed this completely, but my plan is to try to do maybe 2 a week for the next couple of weeks. I just want to do a concentrated series, and then I am putting the finishing touches on my quiz, so I want to get that out to you as soon as possible. And I am working on my course. So I hope that's of value to you. So thank you again for joining me, and I look forward to seeing you all soon. Have a wonderful day, and I'll see you soon.